Welcome to today's panel discussion on your role as a GP at Headspace. My name's Sophia and I'm a member of the Headspace Youth National Reference Group, and I'm here today to facilitate the panel discussion. Today's discussion will be an introduction to your role and how it fits within the Headspace Centre service model. I'm joined today by the lovely Sue, Karen and Kelvin to discuss their experience in the role. So if you'd just like to introduce yourself, which Headspace Centre you're from and how long you've worked with Headspace for.
So my name's Sue Barker. I've been working in youth health for a long time, and until recently at Headspace since in Geelong, since Headspace started 10 years ago.
Hi, I'm Karen Spielman. I'm from Headspace Bondi Junction. I've also been working in youth health for a long time and have been involved in the setting up of Headspace since it started in Bondi Junction 2 years ago.
Hi, I'm Kelvin Lau. I've been working at Headspace Collingwood in Melbourne for coming up to 5 years, and I'm also just starting in Headspace Bentley in metropolitan Melbourne.
Okay. Well, thank you so much for coming in today to talk about the role. We might just start by asking, so why do you work at Headspace?
I work at Headspace because I love working with young people. It's challenging. We're seeing young people who may not be able to access a GP elsewhere, and also with family, it's really flexible.
Yeah, cool.
I work at Headspace because I think it's a really good model for how to access young people who find it difficult to access GPs, and I'm very passionate about young people being able to get their needs met within the health system, and I find it a really lovely, challenging, holistic mix of medicine.
I really enjoy working at Headspace because I have the time to give the attention that the young people deserve, which doesn't always happen in private practice. And also the team that I work with at Headspace, I'm not just by myself, I'm surrounded by very passionate people from different disciplines with different perspectives, and it's a wonderful environment to work in.
So tell us about your role in a Headspace Centre.
So I see my role as providing holistic care to young people, so physical, sexual, mental health, and GPs have a role in coordinating that care and working with the other clinicians in the team as well. I also, as one of the more senior doctors, I have a role in supervising other GPs and other clinicians at the service as well.
I agree with Sue, that's all really important parts of our role as GPs. Another aspect I find is advocating for the role of GPs in the community within Headspace, and acknowledging that young people might come in with their own GP, so being able to advocate and communicate with community GPs is very important, and linking and coordinating with the other practitioners within the centre to provide the young people more holistic care.
In my experience, my role as working as a GP in Headspace has been very dynamic, and if you would have asked me 6 or 12 months ago, I probably would be giving you very different answers. Currently, I'd see my role as providing a service that the other team members can't provide, rather than duplicating what they offer, and also as a way to help young people navigate a very complicated health system. I think as a GP, I have a lot to offer there, where perhaps other more specialty services may not be able to do that.
What does a typical day for a GP look like at Headspace?
I don't think there is a typical day. There are some very quiet days when young people don't turn up. And then there are days where everyone turns up and unexpected people turn up. And so it can be very unpredictable. And I guess my day usually starts with a brisk coffee, followed by a quick team meeting with the rest of the staff, which I find is very, very good. And then it would be a mix of seeing young people ranging from early teens all the way through till their early to mid-20s. And it's not just mental health. I help young people with what would be regarded as regular GP stuff, physical health, filling out forms for university, helping with their employment, with the paperwork there, but also assisting them with just getting through the system of mental health and understanding the complexity of mental health. Yeah.
One of the things I love about Headspace, I'm only there once a week, is connecting with the other team members. So when I come in, I try and catch up with the centre manager and the practice manager, check my messages, follow up on things. I'm often trying to catch up with the youth access clinicians to follow up on people that I maybe saw last week, to check in with what's been happening, see if there have been any developments that I need to be kept aware of, checking results. Like Kelvin says, sometimes people don't turn up, and I really use that time to try and do a little bit more management or more process stuff around the centre. And I have a registrar as well, so I need to make sure that I have time to catch up with her, do some teaching or debriefing, supervision. So it's a varied and terrific day usually.
Yeah, so I've worked in a very busy Headspace, so I usually get into work maybe half an hour before starting to see patients, look at results, incoming correspondence, then attend a quick team meeting like the others, and then half-hourly to 1 hourly appointments. There's usually phone calls relating to those appointments, and like Karen, I also have a registrar, so checking in with the registrar, making sure that they're going along nicely as well.
What are some of the unique characteristics that a GP could add to a Headspace centre?
Look, I think the GP is in a great position to have an overview with young people, and so they can coordinate care and liaise with other workers, both on-site and off-site. And as well, GP, of course, can provide holistic care, so not just mental health, but those other things that are often associated, physical health and sexual health as well.
Yeah, I agree. I think we really enhance what the Headspace model offers for young people, in that we have a very multidimensional perspective to bring, so developmentally, physically, mentally, and in terms of accessing the system, being able to navigate for the young person within the system, and also for the family, for the other workers. It's quite complex really, but that's our one of the major skills that I think we bring is that, I think multidimensional probably sums it up, being able to connect. Somebody once described it like being the head of an octopus, and I think that's quite a nice thing, that you've got kind of connections going in different areas, and can kind of think about how it all fits together.
I agree with Karen, and that our role is putting together different perspectives from different experts, so to speak, different professionals, and helping translate that to the young person is very important. I come from an academic background, and from that, I guess, theoretical perspectives are being brought by the psychologist, by the social worker, by the psychiatrist, in explaining what mental health and mental distress and illness is to the young person. And as GPs, we are actually overlapping many of those perspectives, and we can help the young person translate some of those different understandings. So I think that's something that we can offer that perhaps other professionals may not be as effective in offering.
I think one of the other really unique things about general practice is that you don't need to have a reason to come in and see us. So there's no wrong door, there's no wrong reason to come and see, and we can also offer unlimited sessions. So we can really provide a linkage between other services within the centre. We can pretty much manage anything without wanting to sound too arrogant, but we can manage things in the meantime, without
Yeah.
having to run out of sessions. We can hold things, observe while we work out where to manage something, and you can always leave the door open. Young people, we can always say, pop back in. You can always catch up with us if there's something else going on, and we can look at things again. I think that's quite unique within the Headspace Centre too.
How is general practice at a Headspace different from other settings like a private clinic, for example?
For me, the biggest difference compared to regular private practice is my appointments are twice as long as what I would allocate for a general community private centre. My regular consultations are 30 minutes, and for the extended sessions, such as doing a mental health assessment, I allocate 1 full hour. And I find that the extra time reduces a lot of stress for me, and it makes the consultation much less rushed, and it also gives that time to build rapport with the young person who may feel anxious, uncomfortable, particularly in the first few minutes. And for me, that's a big difference.
Yeah.
I also like having the multidisciplinary team on site too. So I love when maybe one of the youth access clinicians will bring somebody down and introduce them to me. The GP is free, would you like to come in and chat? There's a little bit more spontaneous things happening sometimes. Obviously the time pressure is a big one as well. It's really lovely not to have to rush. It has its consequences in how the practice works, but it's a real bonus.
Yeah.
I think another difference to regular general practice is that all of the clients are bulk billed. So, and that, I know that happens in some private practices, but not commonly. The other thing is that we are seeing a lot of mental health compared to regular general practice, and sometimes many of the young people are presenting with multiple issues. So when I was in private practice, people would usually come along with a particular problem, whereas young people can come along and they can have multiple things going on at the same time. And of course, I didn't say that Headspace is, of course, for young people. So we're looking at young people from 12 to 25. So if you're doing that work all the time, you actually become quite, that can become your area of expertise. And so you're learning a lot about young people's health as you go along, and I think becoming good at it.